In a gesture of goodwill and cooperation, the Chief Medical Director of University of Benin Teaching Hospital (UBTH), Professor Ize-Iyamu, led a management team on a courtesy visit to the Governor of Edo State, Senator Monday Okpebholo. The meeting aimed to strengthen ties between the hospital and the state government, ultimately enhancing the delivery of healthcare services in the region. Professor Ize-Iyamu expressed profound gratitude to Governor Okpebholo for his steadfast and commitment to improving various sectors in Edo State. She commended the governor's efforts in education and economic development, emphasizing how these initiatives have positively impacted the well-being of the citizens.
So we are here, sir, to tell you about the parlous state of health in Edo State. Edo State is a very, very important state in the South-South. That's why we are called the heartbeats of the nation, because we are like a confluence of where all the other states meet. And we have a lot of people passing through Edo State, from the north, from the west, from the south, from the east. We have a lot of trauma cases, accident victims, crises from communal matters, domestic violence, other things that affect the health of the people. And the population of Edo State currently is approximately 4.2 million. It's growing by the day. And because it's growing by the day, the existing health facilities are grossly inadequate. The way the health system works, it starts with the primary health care, where everybody is supposed to have a medical home. And if done properly, it actually reduces the burden of disease, in that every individual is supposed to have a health home, and that if properly carried out, you map out areas based on the population, and people can go there at the primary level to take care of basic sicknesses like what we call know your numbers, know what your blood pressure number is, know what your blood sugar number is, know what your prostrate level number is, know what your eye pressure number is. So if the healthcare system were working optimally, people will go there and they will not deteriorate. Beyond the primary healthcare level is the secondary healthcare level, in which those sicknesses you meet in the PHC level, snake bites, minor cuts and bruises, minor diseases, cannot be curtailed at the PHC level, which is controlled by the local government. They're actually to move to the secondary tier of health, which are the general hospitals. Unfortunately, Edo State before had a hospital that was called the Central Hospital, that was built in 1902 by the colonial masters, which was very, very pivotal in taking care of the health challenges of the poor. You know, we have private clinics, private hospitals, but those ones are expensive. So the colonial government then built the Central Hospital. That was like a 300-bed hospital. And from that 1902 till date, there was no expansion. So the hospital was oversubscribed, but it was taking a whole lot of the financial burden of patients in Benin City and beyond.
She also expressed the challenges faced by the teaching hospital, including funding, staffing, and the need for modern medical equipment. Professor Ize-Iyamu highlighted the various ongoing projects at UBTH aimed at improving patient care and medical training, and she solicited the governor's support in addressing these needs.
The hospitals that are to serve the various LGAs, for example, Auchi General Hospital is in a bad state of repair. So most of the patients from Edo North, Edo Central, Edo South, they come to UBTH. Some of them, before they get to UBTH, they are in a very critical condition. So UBTH right now is oversubscribed. Currently, we have 950 beds from initial 740. Even those beds are not enough. Our accident and emergency room is oversubscribed. We have too many patients because there's a big healthcare shortage. We're not talking of manpower now, sir. We're talking of infrastructure. This is a big challenge to us. And we see the burden of the poor. Most of these hospitals are meant to serve the poor. They are meant to serve those people who we call underserved, those who cannot afford it, so that the prices they will pay, we give them quality treatment. So UBTH, which was originally designed as a tertiary health center to take care of more advanced and complicated illnesses, is now doing the work of a primary healthcare center, a secondary healthcare center, and a tertiary hospital, and also a referral center. So we have a huge burden. Edo people are crying. We came to you, sir, cap in hand, to appeal to you. We know the passion you have for health, the passion you have for the people, especially the poor. I know that you are very passionate about the poor. And we want to appeal to you, sir, to your good office, to support us as an institution. We know we are federal government, but we are within the state and we are serving the people of Edo State. And if the people of Edo State are angry, they will be angry with all of us. And we want to make them happy. And I know you have been making them happy, and I know that you will continue to make them happier by the things that you would do.
Governor Okpebholo affirmed his administration's dedication to supporting health initiatives that promote well-being and enhance medical services in the state.
My interest is to see that Edo is developed and we have the best, and that is the reason I recommended her and I stood for her. You have spoken eloquently, and I'm so happy with your presentation, which I believe that you are not doing this just because you are a CMD. You are doing it because it's part of you. You have outlined so many things, and you have specifically asked for the building. You know, when we interacted initially, I asked you how much would this cost. You made mention of about 2.5 billion. We will put up a memo to see that you get the fund. We'll present it before the ESCO. I know everybody at the ESCO will also buy into it because we don't have any other state than this state, and the children are our children. So if it's me today, tomorrow it can be someone else. So we need to protect our people. We need to protect our children. So I want you to be rest assured that UBTH is part of us, and it's Edo's property. Let me also use the opportunity to thank Mr. President for his renewed hope agenda for the country, and it's paying off.
The courtesy visit not only underscored the importance of collaboration between government and healthcare institutions, but also reinforced the mutual commitments to better the lives of the people in Edo State. From the government house, Edo State, Benin City, Osagie Kennedy reporting for AFMI Reporters TV.